Hi, I'm Dr. Nezami, board-certified plastic surgeon by American Board of Plastic Surgery. I have been performing breast augmentation surgery for 33 years. Over the past year, I have noted that there is a common concern many women have and ask, how often should I replace my implant? There is a myth and a general misconception that the breast implant must be replaced every 10 years. I don't know where and when it started, but I know that there is no expiration date for the breast implant that are implanted. There is an expiration date on the packaging of the implant, but this is an expiration date for sterilization of the implants. The 10-year myth may have started when the manufacturer started offering a monetary compensation if the implant failed before the 10 years. If you are not having any problem with your implant, there is no need to replace them, no matter how much time has passed. There are plenty of the patients whose implants have lasted over 20 years without any trouble. Breast implants are not the permanent device and will need to be replaced at a certain point. As you know, over time your breast can change due to the weight gain or loss, hormonal fluctuation, aging, and the effect of gravity and the weight of your own breast or the implant. If you become dissatisfied with the size of your breast or there is any problem with your implant, you need to replace your implants. A rupture or leakage of a breast implant is one problem that will require you to replace the implant. If happened before 10 years, you get a monetary compensation from the manufacturer and a pair of free implants to assist you in the cost of replacement. Saline implant leaks are easily detected. You will notice that the breast becomes smaller in size, gradually or rapidly, or completely deflating. It will not harm you in any way and is not dangerous to your health because the salted water will be absorbed by your body and eliminated. Replacement is recommended as soon as possible before the scar tissue around the implant becomes to shrink. When it comes to the silicone implant, a rupture or leak is harder to detect. If there is a small tear in the shell of the implant, but the surrounding scar tissue or capsule that your body formed around the implant is intact, it may be impossible to tell that there is any leak. The silicone gel is likely to stay in the area of leakage in the capsule or scar pocket, and your body will not absorb it. Therefore, the implant will maintain its volume. Sometimes the only way to tell there is such a leak is to have an MRI. In fact, FDA recommends that you obtain an MRI of your breast 3 years after breast enlargement with silicone implant and every 2 years thereafter. Replacement is recommended once a rupture or leakage is detected. Now, let's explain why the implant leaks at all. When the implants are placed in your body, some scar tissue form around the implants, called capsule. For the breast to feel soft, the capsule should be the size or larger than the implant. Therefore, the implant will slightly move inside the capsule as you move or engage in any activity. This movement will gradually thin the shell of the implant to cause the rupture. If the capsule is smaller than the implant, the breast will feel hard and look deformed, and there is less movement of the implant inside the capsule, and therefore the implant may last longer. Due to the shape of the chest and rib cage, the implant may fold, and the end of the fold will rub against the tissue and become thinner and finally leak. A pinpoint tear in the saline implant will leak, but not in the silicone implant. The saline implant can leak from the valve also, where it was filled, due to malfunction of the valve or growth of some tissue in the valve. As always, I'm available for any question that you may have. I encourage you to look at our pre- and post-operative photographs in our website and also read our patient testimonial. Thank you for watching this video and your attention.